I'm joined today by the Houston Health Department Director Stephen Williams, the City's Medical Director Dr. Purse, Mino Davis from our Office of Human Trafficking and Domestic Violence Initiative, Chief Pena with the Fire Department, Assistant Chief Wendy Bambridge, and then HPD Lieutenant Julia Pleasant, and others who are gathering with the city on an important initiative. First, I want to provide an update on the City of Houston's COVID-19 numbers. The Houston Health Department reports 367 cases of COVID-19 today, bringing Houston's total to 87,566. There is one newly reported death, bringing the city's total to 1,374. The person who died was an Hispanic male between 40 and 49 with underlying health conditions. Today, Houston's positivity rate is 6.9%. If you can recall last week, this time it was 6.7, so it inched up ever so slightly from last week. That number is still too high, and again, the goal is to return to 5% or less. Our positivity rate is very important, so let me remind people to keep these masks on and to engage in social distance. COVID-19 has changed our reality, and we must continue to change our behavior to meet this new reality. We know what's happening all around us throughout the country, even in places like West Texas, El Paso, and so we need to do our part to make sure that this virus remains in a manageable state. To remind us all of the importance of doing these things every single day, the Houston Health Department today launches Phase 2 of its public health campaign, Don't Stop, Don't Forget. We have two videos to show, like Better Together, Don't Stop, Don't Forget, includes multilingual advertising across radio, TV, print, social media, website, and billboards. Let me pause for the two videos.
Small things we can't forget to do, or we can't afford not to do. We embed them in our brains. We repeat, for our safety, for our family's safety. We just added a few more for everyone's safety. Remember, every time helps, every day counts. Mask up, social distance, wash your hands, get tested, don't stop, don't forget.
Todos tenemos nuestras pequeñas rutinas. Cosas que hacemos casi sin pensar y que no podemos olvidar. Que repetimos una y otra vez por nuestra seguridad y por la de nuestra familia. Ahora tuvimos que añadir algunas más para proteger a todos. Cada día cuenta. No te olvides. Ponte la máscara. Distánciate. Lávate las manos. Hazte la prueba. Hazlo siempre. Haz que cuente.
Moving forward on today's other announcement, the COVID-19 pandemic has created significant challenges in our community, and the city has responded with programs and funding provided by the CARES Act to directly benefit our most vulnerable Houstonians. Today, we are intensifying our efforts to address domestic violence, where we are seeing a rising number of cases during the pandemic. The Mental Health Division of the Houston Health Department, Crisis Intervention Response Team, and community partners will enhance their reach to serve more domestic abuse victims and those suffering from mental or emotional illnesses. This public health and law enforcement initiative is intended to better address the emotional and mental stress that is at an all-time high level in our community. People have lost their jobs, they're at home more, people are facing substance abuse or homelessness. The Domestic Violence Response Initiative is needed now more than ever, given that COVID-19 has negatively impacted Houstonians, especially where the victim's partner's work schedule has been strained, resulting in increased financial hardship and stress in intimate partner relationships. Recognizing what we are confronting, we are putting $6.2 million in CARES Act funding to assist victims of domestic violence. We do know that domestic violence offenses have increased to 9.39% in March, 3.79% in April, and 15.15% 15.51% in May as compared to the same months in 2019. And domestic service calls are more violent than pre-pandemic incidents. Calls related to family violence, such as aggravated assault, have increased by 48%. Victim advocates are more frequently conducting their own scene crisis response and interviewing in hospitals because victims are being immediately transported via ambulance from the scene due to the severity of the domestic incident. Suicides have increased 8% during the same period. Mental health-related calls are projected to exceed 45,000 crisis intervention calls in 2020, an increase of 5,000 over last year. The additional funding will allow for CERT crisis intervention response teams and DART domestic abuse response teams to respond to more calls. A CERT team pairs an HPD officer with a master-level clinician from the Harris Center of Mental Health and Intellectual and Developmental Disabilities, formerly MHMRA. HPD has currently 12 teams. In addition to their knowledge of mental illness and counseling experience, the clinicians have direct access to consumers' medical data, and the Harris Center and Harris County Hospital District systems. A DART team pairs an HPD officer and victim advocates with the goal of providing crisis intervention for domestic violence victims within minutes of a 911 call. By reducing response time to domestic violence victims, HPD will be able to more quickly connect abuse victims with community partners who will provide resources such as emergency housing, short and long-term counseling, legal advocacy, access to free health care, including forensic medical exams or case management.